These sunny days do make us feel good, but it is important to use sun sense. There are over 600,000 cases of skin cancer every year, making it the most common form of cancer. And it can be a killer, so it's really important to know how to spot it. 10 years ago, Roger Hicks had a mole on his arm that had been changing for about a year. It seems that now we've heard over and over that this could be a warning sign of cancer. But Roger says he didn't know.
Back at that time period, it wasn't in the news that much. You know, people were unaware of the hazards of mold and stuff.
That mole turned out to be malignant melanoma, a very serious form of skin cancer that, if left untreated, can spread throughout the entire body.
They are curable by surgery, like a lot of things, if they're gotten early. If you allow them to spread into the lymph nodes, the curability drops off drastically.
And Roger's had spread. He's since had melanomas removed everywhere, from his lungs to his brain.
It is amazing. One little black mole, little dark spot, can cause this much.
That's why it is so important to keep checking moles for changes. Doctors use the ABCDs to spot trouble. Watch for asymmetry. Normal moles are round or oval. Border, melanomas have uneven edges. Color, normal moles are uniformly brown or black. Melanomas are usually multicolored. And diameter, any change in size, particularly anything bigger than a pencil eraser. Any of these should be checked immediately. This is a normal mole. This is a melanoma. Dr. Guy recommends that anything suspicious be removed and tested, because even your doctor can't always spot a melanoma.
In early stages of melanoma, the physician is right about as often as the janitor or the insurance company, about 50% of the time. And you don't want to be on the wrong end of that 50%.
Roger has survived so far with aggressive surgeries and drug therapies, but he'd like to spare others what he's been through.
You know, you put it off for 6 months, it might be too late.
Now, skin cancer is the easiest to prevent of all cancers. Simply wear protective clothing or sunscreen when you are out and about. And it is especially important to protect children and teenagers from sunburn. That's because the worst damage to the skin does happen early in life. Now, we want to show you exactly how it works. A cutaway of unprotected skin shows that most ultraviolet rays penetrate and break down underlying tissues. That causes blistering. Protected skin reflects most rays. Melanin cells absorb light and move up toward the surface to form tan. Scientists say tanning is actually skin responding to injury from UV light. Cancer survivors like Roger Hicks are celebrating, though, out at the zoo tomorrow at the annual Blossoms of Hope. Now, if you are a cancer patient and you would like to join in the celebration of life, call 800-753-9119. Once again, that number for tomorrow's Blossoms of Hope, 800-753-9119.